Hello, Thrive Nation. It's SteveStavs, Africa's pro biohacker, and I've got a very, very special guest on the show. He's really special to me. He doesn't know me. We've just met. But literally, and this is a picture of my family, he's changed me and my family because of the work that he's pioneered in the area of oral health. So I do want to welcome a board certified cardiologist. He's an attorney as well. He's got 10 groundbreaking medical books. It's an honor and a privilege to have Dr. Tom Levy on the show.
Happy to be here, Steve. Hope we can get some good stuff out there to the audience today.
Brilliant. And I do want to talk about this book here, and I recommend that everyone should be getting it, The Hidden Epidemic, with the most incredible subtitle, Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. I want to
I'm giving away that ebook on that for free, so we can later on give the link where somebody can go download the ebook for free.
Fantastic. And you've been so generous, and I'm still getting through your, is it the Rapid Recovery ebook that you got for free as well, and this book as well. So very generous with all your work, and you're a true doctor. My community, the Made to Thrive community, knows what the word doctor means. It comes from the Latin docere, which means to teach. And so you've been teaching for a long time. And so you've impacted my family here in South Africa and my generations because of your pioneering work in oral health. But it's a big statement to make, Doc, and I want you to unpack just the backstory, your mentor, Hal Huggins, and how that happened, because he has a cardiologist, board certified, saying that most breast cancers and heart disease comes from the mouth. I mean, it's a huge statement to make. There's a lot of science and research behind this, so this is not airy-fairy stuff out there. Can you unpack your story, how you got into oral health and how it's impacted your life and those around you?
Sure, and let me also start by saying that the subtitle of the book is understated. I mean, it would be very difficult to find a heart attack where the coronary arteries were not chronically infected with pathogens from the mouth. But anyway, I was practicing adult cardiology in Colorado Springs, Colorado, back in the early 90s, and doing well, but a little bored, and I wasn't sure why. Anyway, I came across Dr. Hal Huggins, as far as I'm concerned, the first true and real biological dentist. I met Dr. Hal Huggins in Colorado Springs at a conference, energy conference, Tesla conference. We were into all sorts of stuff back then. And we liked each other. And so he told me, he said, well, why don't you come by my clinic sometime? Let me show you what's going on. And he had a clinic in Colorado Springs that he had referrals from around the world. And it was a 2-week protocol. I mean, there wasn't an inpatient facility. They'd have to get a hotel somewhere. And in the course of those 2 weeks, they'd get all the amalgams changed, the mercury amalgams, any root canals and other infected teeth extracted, including infected implants, not implants in general, infected implants. And on a regimen of a diet and supplementation that I had never seen before. And anyway, on the course of being just good friends, he said, well, you know, a couple times when we're treating a patient, and so I came by, and I saw this pathetic little old lady that just in a wheelchair, not very lively at all, and I mean, she's going to go in for about 3 hours worth of extractions and this and that and the other. And I just think about myself as a college freshman undergoing a root canal, not a root canal, a wisdom tooth extraction, and wanting to go home and go to bed for a week. So I said, how does this work? And I watched it all, came through, and as the process went on, she got more and more and more lively. And by the end of it, she was enthusiastic for her caregiver to take her out for a big meal on the town that night. And I said, okay, Hal, I give up. What's going on here? And he pointed at the IV bag. I said, okay, I'm familiar with IVs. What about the IV? He said, well, it's got 50 grams of vitamin C in it.
Wow.
And that just blew me away. And I mean, if you look in the medical textbooks, if you look at a 3,000-page medical textbook, they mention vitamin C as a vitamin and preventing scurvy, and that's it. Now, if you go to the medical literature, you'll see 50,000 different articles talking about what vitamin C has done clinically in laboratory data, et cetera, et cetera. So I'm not in the habit, I'm not patting myself on the back, but I'm not in the habit of ignoring something my lying eyes have witnessed. Okay, so I said, something's really fantastic happening here. And that began my odyssey. That began my process, okay? And about four or 5 years later, well, for most of that time, I put together, gosh, I guess 6 or 7 years worth of research for the first primary vitamin C book, Curing the Incurable. And then, so here we arrive today. And it's kind of interesting how one thing has progressed to another. Sometimes I get an interest in something, and lo and behold, once I do the research, write the book, etc., I see how it comes back around full circle to vitamin C, increased oxidative stress, and chronic disease. And that's where we are today. The cover of that book that you have there, I was going with a friend to hold her hand, if you will, while she got some root canals extracted, because she knew my work. She said, well, I need to get them out. And she had 3 root canals. And then, so they did a preliminary 3D cone beam examination that just gives you detail that's not, you can't even approach on a regular x-ray. And they put it up there, and from across the room, and it's on the cover of that book, you could see that although you couldn't see it on the regular x-ray, on the cone beam x-ray, you could see where the bony bottom of the sinus had completely eroded away, large abscess around the tooth going into the sinus. And I said, oh my goodness, I sort of have good news, bad news. Said, we found something that's going to help you out, but you have to have a 4th tooth extracted. I mean, I didn't even need to know what was going on to say, hey, you can't keep an infection like that in your mouth and expect to thrive. And that began the process. The interesting thing is it was asymptomatic. And that's when the light went on, the bell rang. And as it turns out, and as you see in the research in the book, they have tons of studies from around the world, many of them with regular x-ray and not this super refined x-ray, that show this incredible number of chronically abscessed teeth in just about every population on the planet. A chronically abscessed tooth ratchets up your oxidative stress, which sets the stage and provokes all chronic diseases, and especially it hits hard on heart disease and cancer. And they have the data on those. The data on the rest of the diseases is indirect, but as I mentioned at the outset, and this is something that's mentioned in the other book, Rapid Virus Recovery, we have an entity called chronic pathogen colonization. And in this case, you have the infected tooth, you chew on it, doesn't matter that it doesn't hurt, you chew on it and you express into the blood and lymph even more efficiently than a needle in a syringe in the vein, the pathogens and toxins that are present in the tooth. Now, how do they get to the heart? Well, that's interesting because when it gets into the vein is low pressure. Relative to the artery, the vein is low pressure. So there's nothing pushing, if you will, the pathogens into any particular area. They just flow with the blood. So they go on down through the pulmonary artery and vein, come into the left atrium. All of that is low pressure, low pressure, low pressure. In the left atrium, low pressure. Left atrium into left ventricle, low pressure until the ventricle contracts. And the moment the ventricle contracts, huge pressure, and the coronary artery receives 25% of the coronary output. So you immediately get a selective high pressure buttressing of the pathogens. And in fact, They do have the studies that show, and I like to cite particularly, although there are many other studies, this one is particularly compelling. Dr. Ott in 2006 did a procedure called coronary artery atherectomy. Basically, it's a coronary artery roto-rooter. They do an angiogram and they scrape out the plaque, and then they examine the plaque. Well, he looked at 38 different coronary disease patients. He also looked at some normal patients and did not find what I'm going to tell you about. And he found over 50 different periodontal and oral cavity pathogens in those specimens. And he found them in 38 out of 38, which, as I like to say, somewhat sarcastically, that's pretty darn close to 100%. So I don't know. I suppose if you look long enough and hard enough, you might find somebody for other circumstances that got a heart attack because they have an infection somewhere else in their body that spread. But you really can't develop the atherosclerosis without an ongoing chronic pathogen presence in the coronary artery. What happens is the oxidative stress, the pathogen completely uses up all the vitamin C in the arterial wall. Then what happens is that causes inflammation. And when you have acute inflammation, you bring in the immune system. What's the first cell that comes in to this area of inflammation? It's the monocyte. The monocyte has 80-fold, 8,000% more vitamin C inside it than the blood. So it's a selective vitamin C delivery system that the immune system tries to compensate. And if you just had a one-time pathogen exposure, that would be fine. But what did I say? It's going to come in and come in and come in. So the acute response becomes a chronic response. And it's the chronic inflammation that builds the plaque.
Wow.
The vitamin C is necessary for collagen and connective tissue strength. Now, the body needs to compensate for life-threatening events as best it can. What would be a life-threatening event with a coronary artery? A rupture. The coronary artery ruptures, you're dead. Well, if you can't make strong arterial wall because you don't have the vitamin C, what's your compensatory mechanism? Make the wall thicker.
Yeah.
And that's the building up of the plaque.
Great. And I want to just sort of deconstruct and distill that long story, because firstly, you found a mentor in Hal Huggins, and I'm a huge believer in mentors. He guided you along the road. He obviously knew as a biological dentist how important oral health was. Through your book and Dr. McCullough's work, I'm at a biological dentist. And that's why I'm so grateful to a person like you in terms of just putting it out there as a cardiologist, because, you know, I'm in a building here. I've been in practice for 22 years in a building of 6 dental practitioners. They don't believe that root canals cause problems. They're still using titanium implants. They still, you know, not understanding what abscesses do. They're not doing the cone beam tomography that you speak about. So you're obviously trying to change this narrative. There's a lot of research. I do want to ask you, how is it going to change that an abscess and periodontitis and all these oral infections is going to change the narrative and the meme when people like Netflix take off a root cause documentary? And that's when I saw that, and I knew your work, and I read your work, and I listened. I said, here's a documentary called Root Cause. It gets pulled off. How is this narrative going to change? You've got a legal background, you're an attorney. What are we going to need to do to change this picture of what a root canal is? I mean, every second person, not every second person, you know, 80% of people are doing root canals. You know, 80% have got probably abscesses that have been undiagnosed because they're doing a Panorex and they're not doing this cone beam 3D tomography. So how is this narrative going to change, Doc?
Well, that's an excellent question. And it certainly implies that we're all optimistic that it will change. Unfortunately, as you're well aware, the thing that runs everything, medicine included, is money, period. End of story. I mean, if you're someone who loves your doctor and you're doing fine, great. But odds are you're with your doctor and you're doing okay and you're dealing with chronic symptoms and toxic medications and you're not doing so okay, but you still have your trust in your doctor. Well, it's good to trust whoever you put yourself into their hands, but it's not a good idea to do that until you've done your own due diligence, until you've looked into things yourself. Because what I'm saying, and Dr. Kulatz and I wrote another book some years back called The Toxic Tooth, which went into a lot of detail just on root canals. The Hidden Epidemic expands on that a bit. But the bottom line is what we're talking about is not hidden information. And gosh, with mainstream dentists, mainstream physicians, the most overwhelming and flagrant characteristic that they all have, in my humble opinion, is arrogance. Okay, they will not be advised. They will not be told, this is the way we do it. Shut up or go see somebody else. And I don't know how you can get much more arrogant than that, but truth be known, that's the message that you get. And when you seek out a dentist and you seek out a doctor, if he or she is not willing and even welcoming to sit down and answer your questions, don't walk out of that office, run out of it. So the data is all there. I mean, as you well know with the book, wow, and the data, interesting, is in the dental journals. But believe me, the best place to hide an important medical or dental fact is to publish it in the literature. Mm-hmm. Okay, it's kind of like just getting in the literature is the accomplishment. Applying its importance is irrelevant. Okay, so every intervention that you do, even no matter how clear-cut the intervention is in resolving whatever it's being done for, the researcher will not conclude that intervention cured condition A. They will not do it. They've never done it. I don't think they ever will. All they'll do is they'll say, this intervention appears to have positive impact on this condition. Further research and double-blind studies are needed. I mean, it's almost reflex. So what can I say? And the other thing too is you say dentists and physicians, they don't believe in this or they don't believe in that. Well, we're not talking religion here. Yeah. Okay? You either have a logical, scientific-based mindset or you don't. And you either have, and I'm sorry to say, I'm not setting myself up when I say this, you either have integrity with regard to putting your patient's welfare first and foremost over everything. And I can't say many dentists or doctors do that.
Yeah, that's true. And that's very powerful. And I want to talk about periodontitis because what I found interesting that I learned from your work, that if a tooth is painful, doesn't mean that tooth is not dead. And if a tooth is painful, doesn't mean that it's alive. So why don't you just expand on that? Because I thought that was really, really important. And that's why you need the cone beam. You need to see if there's an abscess. Even if there's a small abscess, then that tooth is dead. As once again, if there's an infection, that tooth needs to come out. So let's talk about periodontitis, how important that sort of quick analogy that I gave you is, and what diseases are related to chronic apical periodontitis.
Well, you know, when you have an infected tooth is abscessed, the pulp of the tooth, the area of the tooth above the gum line, is dead. It's necrotic. There's no living matter there at all, but it's still attached to the rest of the hard tooth structure that's situated in the bone and in the periodontium. And that can get chronically inflamed and hurt like hell, and which still means it can hurt, but the tooth is dead. All right. On the other hand, and this is probably the more common situation, is everything in our body breaks down as we get older. That's part of aging. We can slow the process, we can't stop it. And lots of people, even if they have good oral hygiene, they get a little older, they bite hard on something, and you get a little split in the tooth, a little fracture. Doesn't hurt, but the fracture allows pathogens inside the tooth. The next thing you know, they don't know it, but if you did an examination, you'd see an abscess on that tooth because the pathogens got inside the tooth. The tooth should be sterile. in the pulp. It should be sterile. There's no place for any pathogen, microbe, or anything there at all. So, and that occurs gradually, and gradually is why it doesn't hurt. For example, if you have an acute breach of the pulp, and then an infection sets in, what happens then is the infection grows rapidly, and the rate of the growth puts the fibers on stretch, which is why an acutely abscessed tooth is just about one of the most painful things you can have. But when it takes place slow, there's no increased pressure. The abscess actually has an outlet through your lymphatics and your blood system to decompress it from time to time. And they're completely pain-free, greater than 95% of the time.
Wow.
And so this brings us to the point where we haven't talked about oxidative stress and its impact in general on disease, but if you don't have increased oxidative stress, you'll not develop disease. The greatest source of increased oxidative stress is infections, okay? They produce pro-oxidant byproducts, and they release a lot of iron, okay? They specifically proliferate on iron, which is highly pro-oxidant. So they can show, and it's in the book, that, and boy, the medicine loves to say there's a relationship, there's a correlation, there's a this, that, and the other, but they won't say A causes B.
Yeah.
Well, I'm going to tell you, gum disease causes and aggravates just about every disease there is, okay? And when you're able to do the studies and resolve the gum inflammation, let's say there's no infected teeth, just inflamed gums, you can resolve that periodontitis, diseases start to lessen. It's because the disease needs an ongoing source of oxidative stress. If you don't have an ongoing source of oxidative stress in the tissues that are affected, and you have a good diet and you're taking in a lot of good antioxidants, you should resolve that disease. It should be resolved. It should go away. But they don't, right? They don't. Diabetes doesn't go away. High blood pressure doesn't go away. Fibromyalgia, none of these things. That's because in the tissues that are affected and infected, as is described in rapid virus recovery, those are continuing to supply increased amounts of oxidative stress directly in the tissue. It's like a built-in turn on the gas burner and accelerate things.
Yeah.
So no, periodontitis truly starts so much disease because, except for the case where you have the fractured tooth that I talked about, the much more common scenario is people get infected gums, and the infection works its way down between the tooth and the periodontium and finally starts to seed the apex, and you form an abscess. And if you resolve the gums, take out all the teeth that are infected, guess what? And this is not addressed very much at all, but it'll give you a heart attack just as quick as anything else, is the residual normal appearing chronically infected tonsils that have been draining all those pathogens and toxins for the whole period of time. So you absolutely need a biological dentist who has ozone, because that's how you deal with it. You directly inject ozone into the tonsils, and it's the only thing I know of that can, at this point in time, that can resolve chronic tonsillar infections, as is reflected by an increased C-reactive protein in your bloodstream, showing that you're in a state of chronic increased oxidative stress.
Brilliant. And we'll get into that. You know, I've been practicing ozone in my other life for 10 years. I studied with Dr. Frank Schellenberger. So I'm a big ozone fan, and we'll talk about hydrogen peroxide because I think that's important. You know, I picked up the nebulization from the Ozone Association in America. But I do want to talk about periodontitis because there's the Dr. Pesci article showing what happens with asthma. I think that's important. There's been a huge exponential growth in asthma and conditions in children and adult onset asthma. So tell us about the specific conditions. We know that heart disease, that's your area. Breast cancer, I think from what I remember, the studies showed that 97% of women that had breast cancer had a root canal on the same side. Tell us about the other conditions, the autoimmune conditions, and Dr. Pesci's study.
Well, you know, Dr. Huggins found to my satisfaction that virtually all autoimmune diseases are triggered by and propagated by oral infections. If you have a pristine mouth, you can't get an autoimmune disease. We would have patients that would come in from around the world with highly elevated anti-nuclear antibodies consistent with lupus or a different autoimmune disease. And many of them would be either normal or near normal at the end of 2 weeks when everything got taken out of the mouth. So you can't, and the other thing too about other autoimmune diseases like thyroid, look where the thyroid glands are located. I mean, they're like garbage can draining sieves for all the stuff that's going on in your mouth. It's and in fact, when you start looking at things like T3 and reverse T3, which I don't have time, I don't think we have time to go into much detail there. Reverse T3, we find that the vast majority of people on the planet are minimally subacute hypothyroid, okay, regardless of what the standard thyroid test does. And this is very significant because thyroid hormone is the single most important hormone in modulating oxidative stress. And when you get slight deficiencies, your ability to see oxidative stress goes up astronomically. And I like to use the expression that when you completely and tightly normalize your thyroid function, you keep focal infections focal, and you keep cancers focal and keep them from metastasizing.
Wow.
But the moment the thyroid gets out of whack, then the infected tonsil can set up shop inside the coronary artery or any other place.
Wow.
So,
well, Doc, let's talk about that because my audience does know that TSH. What are we looking at? I know that range is so big, and that's the problem with these medical ranges, looking at a TSH of around 1, and then obviously the conversion from T4 to T3, that T3 figure, really important. And then the ratio of T3 and reverse T3. Let's unpack it because I think that's crucially important. These tests are not done by the standard physician. Even those that are in endocrinology or specialist physicians here in South Africa often don't do these tests in terms of how important thyroid function is.
Yes, it's first of all, and I don't mean to sound disparaging, but most of the standard thyroid tests are not helpful. Okay, let's put it that way. They're not helpful. All right, they're only very good at determining mild to severe hyperthyroidism. No problem there. But when it comes to hypothyroidism, unless it's severe hypothyroidism, they're going to miss it every time. Part of the reason for this is the fact that the standard thyroid tests, not illogically, are looking at thyroid function in the thyroid gland. Logical enough. Well, as it turns out, T4 is converted to T3 roughly 80% of the time or more outside of the thyroid gland and in every separate cell in your body. So you really have several trillion thyroid glands, not one. And the really important thing is how efficiently in your individual cells is T4 converted to T3, which, as you know, is the active form of thyroid hormone. And they have enzymes called deiodinases that cleave off the iodines. And when you have enough of one deiodinase, it makes T3. When you start getting the other, it makes reverse T3. And these things come into imbalance when you have increased oxidative stress. They selectively oxidize and inactivate the enzymes needed to get you to your proper T3 reverse T3 balance. And as a result, we talk about CRP, one of the best ways, without a lot of false positives, which you can get with the CRP, to track oxidative stress is by your reverse T3 level. That will just shoot up like crazy as you maintain oxidative stress. Now, most people are going to have a combined picture. They're going to have mild hypothyroidism, and it's going to be due to an ongoing source of significant oxidative stress, usually in the mouth, and they will have sort of burned out the thyroid gland a little bit, so there'll be a little bit of low output, if you will, of the thyroid. And so you start out managing this, trying to get your T3, free T3 to reverse T3 ratio 19, 20, 21 to 1. Okay. Gets lower than that, you've got problems. You've got a chronic disease, you've got cancer, you've got infections that need to be evaluated, etc. And this can't be over. And the other important thing too, if we're gonna, since I'm on hormones, is make sure the individual's sex hormone is properly balanced. Okay. So many docs think if you get too old, it's not worth it. Well, if you're too old to try to properly and carefully adjust thyroid hormones back into the normal range, you're not worth treating. There's no point in treating. I mean, if you really want to treat your patient, you got to at least get them into the low normal to mid normal range of the sex hormone.
Yeah.
So all of these things come into play, and the really critical thing, and this is a little of a tangent, but I think it pertains here, is Dr. Joseph Issel's, back in the 1950s, ran a clinic for advanced metastatic cancer in Germany. Brilliant, brilliant, brilliant man. I mean, this is like at about the same time as Weston Price and all his stuff. But anyway, he had his own protocol where he made a immune therapy and got some great results, resolved the cancers, but he still found that 15 to 20% of his cancer patients would die of heart attacks. And it frustrated him, and I can't go into all his mindset, but he figured out that the tonsils were infected even though they looked like they were normal. And he actually proceeded to do tonsillectomies routinely on all of his acute advanced cancer patients that came in, and the heart attacks disappeared. Not only did they disappear, and this is in Issel's words, 100% of the extracted tonsils that looked normal were severely and grossly infected on pathology.
Wow.
So, and he also noted that 98% of his patients had one or more infected teeth. Well, this was in the 1950s, so I'm sure if he had a cone beam, at about 110%, right? No, so I think it's hard to find a cancer patient with a normal mouth. I don't know that exists. That's how important the correlation is.
So, Doc, what you're saying is every single person should be having a cone beam. Every single person should be seeing if they've got periodontitis or they've got an abscess. They should be doing that routinely, and they should be doing probably an HSCRP routinely and watching that and trending it and see what is happening with that, because that's a very sensitive test. And then obviously the T3 to reverse T3 ratio, possibly maybe oxidized LDL to give some sort of depiction on a broader spectrum of oxidative stress. I don't know what you think, what the person is listening out there and they're thinking, oh my goodness, what do I do?
Absolutely 100% spot on. Yes. If you're being treated for any medical condition at all, you need this test, okay? Because an infected tooth isn't just going to kill you. It's going to be also something that far short of killing you is going to promote the oxidative stress. And if you give a tremendous toxin exposure to 100 people, you'll get a dozen different clinical presentations, okay? High blood pressure, heart attack, fibromyalgia, this, that, or the other. So it's at the root of all these diseases. Now, I think, based on the evidence in the book, that anyone who sees their physician for the first time, they get their biochem panel, they get their thyroid, they get their CBC, and they should go to the dentist and get their baseline 3D cone beam examination, even if it's a wellness physical, because you do this, let's say on a football player who's 24 years old, very healthy, do it as part of the routine evaluation. And if when that guy is 35 years old, he starts developing high blood pressure, you repeat the doggone test, because there's an excellent chance he now has an infected tooth, and you're going to spare him 20, 30, 40, 50 years worth of high blood pressure medicine and the secondary effects of high blood pressure, heart attack, etc. So another good example too is kids. All right. Kids get just as much crap as adults, okay? But they don't get the attention. If you have a 5-year-old with leukemia, doggone it, get that 3D cone beam exam yesterday. I guarantee you the vast majority of the time, you're going to find infected teeth and give that little person an opportunity to live a normal life and not just be hammered down by 5 rounds of chemotherapy before they cash in their chips when they're 15.
Sure, Doc. This is to the oncologists and the people that are suffering with cancer and heart disease and autoimmune and asthma. We didn't get into that study, but I do want to move on to vitamin C, but even asthma.
Oh,
and
let me make one more point too. I made my cynical points earlier about money in medicine. This helps the patients and it helps the practitioners make more money. Okay, you start doing the cone beams, you start extracting the teeth, more people are coming in for check. What I'm saying is it's a win-win-win scenario. So even if you don't think you're one of those practitioners that doesn't put their welfare of their patients first, remember that, do this, you're going to generate more business, you're going to make more money, and you're going to help more patients.
Fantastic. And I hope you hear that loud and clear, because I think I'm going to get a lot of comments and questions from a board certified cardiologist with years and years of experience. I do want to talk about buffered vitamin C, liposomal vitamin C, and IV vitamin C. Doc, tell us about those 3 different forms. How important are they? And should everybody check their vitamin C levels?
I don't even think you need to check the levels, but there are certain parameters you should go by in terms of how much you should take on a regular basis. Now, buffered vitamin C usually means one of 2 forms. It means calcium ascorbate or sodium ascorbate. Sodium ascorbate is fine, probably even the preferred form of regular vitamin C to take. I have another book that I've written called Death by Calcium, all right? And the title is not an exaggeration. Supplemental calcium is a primary carcinogenic factor in everybody. Wow. The thing that regulates metabolic and oxidative stress inside your cells is the calcium level. The calcium level goes up, you have malignant transformation, you have the development of all the other diseases. So never, never, never take calcium ascorbate, all right? Which is the most common quote unquote buffered form. Now, sodium ascorbate, that's fine. Now you have also the liposomal and the intravenous. Now the liposomal is, the problem with the liposomal is you got to make sure you got the right company. Now I'm a consultant to Live On Labs. They started the liposome bandwagon 15, 16 years ago, all right? And I've been a consultant with them since then. And I can't tell you how many pretenders they have out there that have no problem at all just putting a product, calling it liposomal, and just saying, well, we'll wait till the FDA or the FTC or somebody challenges us, and then we say, oops, okay, well, it's not liposomal, let's take it off the. Well, they don't do that, and the penalties aren't harsh. Bottom line is, except for Live On Labs in the United States and Altriant in the United Kingdom, which has the same product as Live On, I don't know that there are that many legitimate liposome products, and the homemade liposome products are not liposome products. Now, what is a liposome? A liposome is a tiny little nano-sized fat ball that is actually the communication mechanism that cells actually use inside the body. They have little things called exosomes that go from one cell to the other, penetrate the cell wall. Same thing with this. You actually synthesize something that has a bilipid membrane that's identical to the membrane around a cell, literally. And so what happens is, even though you take a small amount relative to other dosing, you get almost 100% absorption, and you get direct assimilation into the cells. And here's the big part, without the consumption of energy. It's so small that it can go through the pores, or reverse pinocytosis, it can merge into the cell wall, and it doesn't consume energy. Even when you take vitamin C intravenously, that's obviously unencapsulated, just vitamin C, you need active transport to get the inside the cell. So you're consuming energy to get an energy delivery product where you want. Obviously, IV vitamin C is still great, but the point is that gram for gram, your most potent form of vitamin C you can take is a quality liposome product orally, which is almost, I mean, everything we think about in medicine is IV is superior. Dose for dose, not in this case. Now, the amount of good you can do with high dose intravenous vitamin C is incredible. All right. So if you're sick, you want all three of these forms of vitamin C. Okay, because the other thing with the oral, the sodium ascorbate powder, is the half-life is very short. Okay, a few hours after you take a dose, most of it that hasn't gone throughout the tissues is out in the urine. So you really need, when you take regular oral vitamin C, for proper impact, you need to dose it 4 times a day. Now, you can dose it less and still get a positive effect, but for people that are sick that want to know how much more can I do to help myself, and I don't have money for IV, I don't have money for liposomes, which are more expensive than regular vitamin C, well, you got to be diligent and dose throughout the day. Lots of people have cured lots of diseases, lots of cancer, lots of everything over the last 80 years just by taking regular vitamin C, a gram or 2 every 6 hours or 4 times a day while they're awake.
And then what do you just wait for bowel distress if you're sort of overdosing? How would you know if you're taking too much? Can it get to toxic levels?
No, you're not going to get to toxic levels. And you're right. The bowels will tell you when you pushed it too far. And what the bowels are doing when they cause this loose diarrhea is it means that a lot of the vitamin C is not getting absorbed proximally, collects in the colon, and osmotically pulls in order to dilute it liquid into the into the colon, causing an osmotic diarrhea. Okay, so it's not a it's a sign of excess vitamin C. It's not a sign of toxicity.
Okay.
A lot of people like to say, oh, that's a toxic side effect. No, it's just a natural physiological response to having a concentrated solute in an area where it needs to be diluted. So.
Great. Let's talk about hydrogen peroxide. I've been using now the nebulization for probably at least 4 or 5 years. Been using ozone in my other life now for 10 years. Doing a lot of prolozone injections, using a lot of ear insufflation, IV ozone and that. Tell us how important hydrogen peroxide is, how different it is to ozone, the nebulization of it. I did hear you with Dr. McCullough talking about the water irrigation device. I'm a little bit concerned by continuous use of hydrogen peroxide and ozone because of the microbiome, the nasal microbiome, the oral microbiome. A lot of people drinking ozone water the whole time. Is there a concern for the microbiome? And tell us a little bit about your history and experience with hydrogen peroxide.
Actually, no concern. It's just the opposite. I wrote the book, Rapid Virus Recovery, because we're in the middle of a pandemic. And I knew that properly nebulized hydrogen peroxide would not only knock out any virus or cold or flu, it would knock out COVID just as easily. And I've since have the experience to show that that statement is true. We can address that a little bit later. And in the course, and this all started 2.5 years ago, I was trying to, well, I've had lousy sinuses and a proneness toward colds my entire life. I'm 70 now. So when I'm 68, I'm getting fed up and I'm doing the research for my magnesium book. And in the course of the magnesium book, they talk about magnesium chloride nebulization for asthma. And I mean, it's just like somebody threw a bucket of water in my face. Nebulization. Let's go to where the action is. Let's just, and so that just spurned a bunch of research. And I can't even remember the first time I decided to do the hydrogen peroxide. But the one thing I did note, I did the hydrogen peroxide nebulization one afternoon. And the next morning, now this is when I'm 68 years old. I mean, I've spent a lot of time in the bathroom. The next morning, I had the most perfect, incredible bowel movement I've ever had in my life. And I said, what the heck is going on here? And that evolved the process. What did I say causes all disease? Oxidative stress, pro-oxidants. What are you exposed to with your gut? You're exposed to with your gut anything that you swallow. All right. Just because you swallow something, it doesn't get digested. Okay. I mean, the enzymes don't neutralize everything. You're swallowing pathogens, you're swallowing toxins, you're swallowing free iron. And also, if you eat enriched food, you're taking in more metallic iron as well. All of these things keep the gut in a state of increased oxidative stress, derange the microbiome, and produce the leaky gut. Now, here's the other thing about the leaky gut. The leaky gut, as you well know, tell those who are listening, that's where the junctions between the cells become degraded. Well, what would degrade them? Oxidation. Okay. So those junctions become degraded, and the gluten and then the peanuts and all the other these things gain access to the body. You have allergies, you have reactions. You also have pathogens that make their way throughout the body as well. Well, there's one point that never gets mentioned is the gut cells reproduce more rapidly than just about any other cell in the body. So every 2, 3, 4 days, you have a brand new set of cells. All right. So what you have when you have chronic leaky gut is you don't have a chronic disease. You have a chronically occurring acute infliction. And the moment you stop the nonstop, for most people, dumping of pathogens and toxins into the gut, those cells heal so doggone fast. Now, I mean, there's going to be some people that have had disease for years. I'm not saying this is going to be a magic cure for everybody, but I guarantee you, and I've already had the feedback, there's going to be very, very, very few people, no matter what their gut condition is, diarrhea, constipation, Crohn's disease, chronic ulcerative colitis, celiac disease, you name it, no matter what that disease is, when you stop that ongoing onslaught of swallowed oxidative stress, you're going to be amazed at how many people are going to normalize and near normalize or just significantly improve. And going back then to the upper area, which we call the aerodigestive tract, nose, sinus, throat, airway, esophagus, when you have a cold, have the flu, and you get over it, you leave behind a chronic pathogen colonization covered by a biofilm that will never resolve until you specifically make a point of taking something that will resolve it. Okay. Now, hydrogen peroxide not only dissolves biofilm, it knocks out all the pathogens of concern, doesn't so much affect the regular microbes, which do not feed on iron to the same extent that pathogens feed. So the iron consuming pathogens self-target themselves, okay? You don't really so much sterilize your airways with hydrogen peroxide as you knock out the pathogens and temporarily knock down the titer of the more normal microbes, which rapidly, in the absence of the pathogens, proliferate to a normal microbial coating.
So now, what you're saying is if I nebulize with hydrogen peroxide, I'm not destroying the good microbiome or the microbiota that is helpful, the bacteria that we need in our nasal passages. If I use hydrogen peroxide with a water irrigating my mouth regularly, as you've noted, you don't destroy the good microbiome or oral microbiome in your mouth. Is that correct?
That's correct. And part of the reason for that too is the nature of hydrogen peroxide. You have water, H2O, you have oxygen, O2, and then you have hydrogen peroxide, H2O2. It's one of the most common molecules in your body. You're producing it on a regular basis inside and outside every cell. In the lungs, you're secreting hydrogen peroxide into the airways to deal with pathogens that come in with every breath. I mean, you secrete peroxide into the urine to deal with the bladder. It's the body's natural antibiotic. And all you're doing, because everything else, as you get old, would start to wear out, is you're augmenting a normal response of your body. Now, other thing, we had all this stuff going on about COVID and bleach and blah, 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 and all that hooey there. Well, the thing is when you inhale hydrogen peroxide, not only are you inhaling a natural substance, but guess what? After the peroxide kills the pathogens, what does it leave behind? Water and oxygen. It leaves behind the two most important things for rehabilitation of a damaged cell: hydration and oxygenation. I mean, you couldn't design something more incredibly perfect for an infection inside your body than the hydrogen peroxide. Then this is covered in the book too. I mean, like I said, I go into certain directions and I find things just start reconverging. So I'm all into the hydrogen peroxide. And then I realize that how does vitamin C kill pathogens? It kills it by activating the ferritin reaction. The ferritin reaction inside your cells is when reactive iron donates an electron to peroxide, turns it into hydroxyl radical that then increases the oxidative stress until the cell ruptures or is killed, or the pathogen. Well, what do you need to keep that going? You need more electrons, and that's what happens, and that's why high dose intravenous vitamin C is so incredibly powerful on infections, because it goes into the cell and it's there and it's supplying nonstop new electrons to the iron to go through the chain. Also, at the same time, the presence of vitamin C massively increases the synthesis of hydrogen peroxide outside the cell, which then easily diffuses inside the cell. And what does that do in addition to what we just said? It also mobilizes iron from the ferritin stored ferritin iron. So you have, when you do IV vitamin C, you sustain all three components of the reaction to keep on going until it runs to completion. So you don't have to worry about one substrate running out and having an incomplete activity. You keep the vitamin C going in, which we should be doing, remember, because we should be synthesizing our own vitamin C. So this is, even though we're taking it by vein, we're imitating something that should be natural, which is our own livers making a large amount of vitamin C when we have the infective stress to go inside the cell, fuel the ferritin reaction, make more hydrogen peroxide, and go to completion.
Sure. Powerful. Powerful. Wow. Fantastic. Can we talk quickly, get a number from you? I know Dr. McCullough has been talking about ferritin. He's going on the lower side now of going to donate blood. And what level do you think we're looking at ferritin? I know this is a contentious topic. The research shows different numbers. I just think it's really important because a lot of people are donating every 60 days, and I get them and they got really low ferritin levels. And that's a problem. I think too high ferritin levels, obviously a sign of often oxidative stress or inflammatory reactions. Where does your close range sit for someone who wants optimal health?
For most people, less than 20. And the thing is as long as you have enough iron to maintain a normal blood count, you don't have to worry about the ferritin level. Because you got to, even though iron has a lot of different reactions throughout the body, plays a role. The thing is the amount of iron relative to those enzymatic reactions, the amount of iron you needed to maintain a normal blood synthesis is massive compared to the amount of iron needed for those subsidiary functions. So if you're making enough normal blood, normal cytic, normal chromic, normal hematocrit, normal hemoglobin, you don't need to worry. You only need to worry is if it starts climbing 30, 40, 50. They already have clear-cut studies that show that just 50, which many people, many docs consider already to be low, is already increasing oxidative stress and promoting vasospasm and other things along those lines. So yes, I support the regular donation of blood, and as long as you don't knock yourself into the anemic category, you're fine. They even have a situation too where a lot of people don't realize you do waste a lot of iron in sweat. They think there's no way to get rid of iron. Well, no, you can sweat out iron very easily. And they've shown studies that have young aerobic athletes, men and women, 50% of the time in this one study, they were able to exercise themselves into a hypochromic microcytic anemia by the end of their competing season, simply because they were sweating out iron.
Wow. Okay, let's move on to your dental oral regimen, how you use this water irrigation device. Maybe, there's very few people that use floss correctly. I had Dr. Dome Nishvitz on. I've had Dr. Al Dannenberg. I've had my own biological dentist on. Tell us about your dental oral regimen.
Okay, and let me say this, because people write me emails. I make my address available, but the way you do it is on page 231 of the free book. So they can download the book, go to page 31, get the details. Don't write me an email saying, how do I set everything up in my water pick? Okay. But I understand. I'm not trying to give people a hard time.
Sure. No.
Okay.
Is this the Rapid Recovery book, 231?
Yes, the Rapid Recovery book, page 231. Now, if you get your hands dirty, what's the best way to clean them? Taking something and scraping them off, or using water? Okay, sure. All right. Same thing with the teeth, but it gets a little more graphic than that. When you floss, everybody who flosses traumatizes their gums. Some that have done it a long time, they get a little bit better at it. But when you take a hard little cord and comes down, all you're doing is repeatedly injuring the gum. All right. I'm totally against flossing 100% relative to the water pick. Okay. Now, anybody wants to do a test run, have a really dense meal, floss like crazy, rinse your mouth, do everything, and then do the water pick, you're going to see all sort of stuff coming out. On the other hand, if you do the water pick first, you'll never get anything out with the floss. Okay. Number two is, what are you trying to prevent? You're trying to prevent infection of your gums that results from debris, food debris that you're unable to access or unable to get out. Well, floss provides nothing. If you have the water with a little bit of hydrogen peroxide in it, I won't say sterilize, but you knock down the pathogen count every time. Do it. If you can't do it several times a day, do it optimally before you go to bed at night, because that way nothing is sitting there getting a foothold over the next 8 hours before you start your regular routine. Same thing with the tongue. You have chronically coated tongues and they're heavily pitted. This causes a lot of problem, a lot of bad breath, a lot of feeding of the chronic pathogen colonization. People should be scraping their tongues. I mean, that's all in the book too. But the point is also, what have I seen on multiple occasions? It's not published or anything, but I've seen people with horrible looking gums, and you tell them about the water pick and the peroxide. And even though the gum has like little flat lines between, I mean, not the little nice inverted peak, they'll look like they have grown normal, healthy gums in 2 to 3 weeks. So all you need to do to get good health in gums is to get the infective agents out. Now, I'm not saying there's going to be some horribly advanced cases of periodontitis that are not going to resolve completely. Of course not. But moderate to mild to early periodontitis, you can expect to cure with this regimen of water picking that I'm talking about.
Wow, that's incredible. Just your perspective on bruxism and how clenching and grinding wear the teeth down and predispose them to sort of microfractures and these pathogens getting into the teeth. There's a lot of people that are grinding and clenching their teeth. They go to the dentist, their teeth are worn down. Is this a real problem? And I mean, grinding and bruxing can come from so many different etiological sort of causes.
Well, I can't say it with authority. It's not something I deal with on a regular basis. And even though I talk about dentistry, I'm not a dentist, so I don't want to act like I'm playing one. But anything that traumatizes the tooth or can cause those microfractures needs to be avoided. So, I mean, if your dentist sees clear evidence of, and there should be evidence that you're clenching and grinding on a regular basis, and follow his or her recommendations for getting devices to keep from doing that. Mostly it's going to occur at nighttime while you're sleeping. So absolutely, that's a factor that should be addressed as well. I can't tell you statistically what % of the time that would end up being a problem, but it's definitely not something that you I mean, you don't really regrow enamel. I mean, you wear away the enamel.
Yeah.
You've worn away your only coating.
Great. And last question, Doc, as we wrap up, biohacking, almost DIY biology, people taking accountability of their health, often working with a health coach, knowing the basics, knowing hydrogen peroxide, researching. You're a researcher. I'm sort of trying to empower people to start researching, asking the questions, walking a road with someone like a health coach, someone that they can trust. Look at all these areas of health, because the doctor, the physician often doesn't have time. The cardiologist doesn't have time to sit every week and help you with these healthy habits. Tell us what your top 10 or top 5 blood test people, the average person out there, they're not doctors, what should they know? Is it the omega-6 to omega-3 ratio test? Is it an HSCRP test? Is it the thyroid? What are the most fundamental sort of blood labs that people should actually know about and test on a regular basis?
Well, you certainly want to know if your liver enzymes are normal. I mean, a lot of people can have asymptomatic problems there, and you should, and that's, of course, part of a regular biochem panel. You need to know if you're anemic or low in platelets, thrombocytopenic. Certainly, all those are autoimmune conditions, and there's ways to deal with them, but most of the time, abnormal lab work will predate clinical expression of a condition. And so it makes a lot of sense. You should certainly check, not because you want to do statins, but you should see how your lipids are running, your cholesterol and your LDL. And virtually all of that is due to dental infections, because cholesterol serves as a primary antitoxin. Okay, so the higher your toxins rise, the higher your cholesterol goes. And this is one reason why statins are so horrible, is because they do knock down the cholesterol, but they don't knock down the toxins. So all you're doing is taking away the protection. And there have a lot of studies. I wrote this in a book almost 20 years ago now, that the lower the cholesterol goes, the higher the chance of cancer. Period. End of story.
Sure.
Back in the day when Nathaniel Pritikin had his Pritikin diet out, he had a phobia about coronary artery disease and heart attacks. I think he had something in the 300s or close to 400 cholesterol, and he developed his strict vegetarian diet, brought his cholesterol eventually down to about 100. And the part of the story that you don't hear about then is that he got leukemia and died. Okay, so you should have a cholesterol of 200, 210, something in those range, 190 to 210, roughly. And they have cardiologists that want to bring cholesterol down to 150, 125, 100, which is insane. And of course, the CRP and the reverse T3 are two great tests.
Well, thank you so much, Doc. What a privilege. I salute you. I declare blessing and favor over you because of your calling, your purpose. You've given your books out for free. We'll put links to those free PDF downloads. I want to just thank you. Hopefully we can have you on the show in 6 months or a year's time, talking more about rapid virus recovery. I think it's crucially important once I've gone through that. But I dispense hundreds of bags of hydrogen peroxide nebulization every month. It's cured people with chronic sinusitis. I mean, from asthma to tooth pain to chronic headaches. I mean, it's just been incredible. All my COVID patients that I've dispensed it out to them. So I want to salute you and I want to thank you. And I keep on declaring the truth because, there's people like me that you've never met before that are listening, that are reading, that are just so grateful. I mean, I showed you that picture of my family because I'm truly, truly grateful that the next generation I can teach, I can empower so that we can change the narrative. And maybe it does take a couple of generations, but you got to start somewhere. You got to start somewhere teaching and educating people.
And just like we mentioned earlier, although it's important for all diseases, anybody who's a heart patient, anybody who's a breast cancer patient, and you haven't gotten the 3D cone beam examination, you're missing the most important chance of recovery and reversal.
Thank you so much. And thanks, Dr. Levy. I really appreciate it.